and you are hopefully intentionally dialing in for our federal and state policy updates webinar. This is an incredibly busy time in early childhood across the country as folks are heading to DC for tomorrow's White House Summit on early childhood education, but also in the state in terms of things that are happening here in Illinois that are progressing, things that are new on the horizon, and definitely we wanted to touch base with you after our November elections that, again, will touch everybody across the country, but definitely we have some developments and changes happening here in the state that we wanted to kind of highlight and really talk through with you. So on the webinar today, we're going to start with the federal policy because all things cascade really from our federal funding sources in DC and some federal initiatives, and so we wanted to start tall and broad. And Samir Khanna, our Assistant Director of Policy, is going to take us through that. And then that will cascade us down to really focusing on state policy and then bring us home and really ending throughout the presentation, but also specifically at the end. We always like to call out a call to action in terms of where is the place for our advocates, for our members to find themselves and to take action on behalf of children and families across the state. So we're asking that you can, we're going to hold questions till the end in terms of our answering them, but as the presentation goes along, if you can email in your questions, we will have somebody flagging those and collecting those, and then we will just, for efficiency's sake, get through the presentation and then look for redundancy in questions and then try to succinctly but clearly answer your questions and definitely do ask us some questions if there's anything that is not clear. Our really two goals today is to always update you on the things that are happening at the state and national level, and it's always a good opportunity for us to re-educate ourselves and our membership across the state in terms of some of the inner workings of policy, both at the federal and state level. So we have gone into a little bit more detail than we otherwise might in kind of a mid-session update on issues. So really, we hope that you appreciate that. We welcome your feedback, but really just trying to review some of the basics of policy as you all serve as experts in your community. And so it's always, we always feel it's our job to make sure that you have the information that you need to play that role. So with that, thanks for joining us. There is much work ahead, and so this is really the launching of that work. And so I'm going to turn it over to Samir to start us off.
All right, good afternoon, everybody. Just a quick thing to note. Instead of emailing your questions in, on your dashboard for the GoToWebinar, there is a questions box. So please just write your questions in those boxes, and we will filter through them and answer them at the end of the session. Thank you. So let's get started here. As Ceci mentioned, we're going to start with the federal update. So first things first, we will talk about the federal, the midterm elections. So first off, just to remind everybody, the U.S. House of Representatives has 435 members. They are up for election every 2 years. So they were up for election in 08, 10, 12, and then again in 14. The representatives are determined by population, so each state is different. California has the highest population, so they have the largest number of representatives. States like Alaska, Montana, Wyoming have low population, so they only have one representative each. The House of Representatives is currently controlled by Republicans and a 246 to 186 member margin. There are currently 3 vacancies. And in Illinois, because of our population, we have 18 federal representatives in the House. And after this election, 10 of them are Democratic, and 8 of them are from the Republican side of the aisle. The U.S. Senate, we actually had a senator up for election this year. We have 2 senators, Senator Richard Durbin and Senator Mark Kirk. Senator Durbin was up for election, and he won. So we don't have a change there. Each state has 2 senators, so we have a total of, since there are 50 states, 100 senators, and those are just apportioned 2 per state. It's not by population. So The reason why that is important is because of the results nationally of the midterm elections. So Illinois has 2 new Republican representatives. We used to have, who are now representing districts that used to be represented by Democrats. So we have a new Congressman Bob Dole from the 10th District, which is the North Shore and Lake County. He won his election against one-term Congressman Brad Schneider. And then Congressman Michael Bost from the 12th District, which is in the Murfreesboro area downstate. He's actually a former state rep. Some of you may know him actually. And he is now representing that district in the House of Representatives, when they're sworn in January. So get to know them if you don't know them already, and we'll talk about that later. And again, as I mentioned, for senators, we had no change in our U.S. senators, so we still have Senator Durbin, who won re-election, and Senator Mark Kirk, the incumbent Republican, will face election in 2016. Their terms are 6 years. So he won, Senator Kirk won in 2010, so he's up for election now in 2016. Since Senator Durbin won this year, he will not go up for re-election until 2020. So now the big change federally is the U.S. Senate is now controlled by the Republicans. Currently the House was controlled by the Republicans, which it still is, by even a bigger margin than it was before this last election. So the U.S. Senate is now controlled by Republicans for the first time since 2006. So with them having both chambers and the president being Democratic, this could, serve for some issues for actually both parties trying to get their agendas passed. But we're hoping that there's more compromise, and one thing that is bipartisan is early childhood and child care. So hopefully we can actually see some movement on some of our priorities going forward. Let's see. So one of the big things that happened, we're going to go through a couple things that have happened over the last couple months. The big thing that happened is the Child Care Development Block Grant was reauthorized. That was Senate Bill 1086. So just to give you some background on the Child Care and Development Block Grant, it is the law, it is a federal law that states must follow when they are using Child Care Development Fund dollars for their child care assistance program. So in our state, we receive federal money for child care, and we use some state money as well. So to implement the child care assistance program using federal money, we must follow the law set forth in the Child Care and Development Block Grant. The Child Care Development Fund is comprised of essentially two sets of funding. There is discretionary funding, which is up to appropriations every year, that comes from the Child Care and Development Block Grant. So right now, that funding level for this year is about $2.35 billion federally. Then there's mandatory entitlement funding, which is nearly $3 billion, again, split by the states. So that mandatory money has to come every year, and that is a dollar amount that has been coming every year since 2008 to the states. And like I said, the states can also pump in their own money as well. So for Illinois, we receive about $196 million in CCDBG discretionary funding. We receive about $450 million in mandatory funding, and our state pumps in somewhere between the previous fiscal year. The state had added over $300 million to child care. This year, unfortunately, and Ceci will get into this later, we are funding around $230 million. So, that's a cut in our state funding, and, we'll talk about those issues going forward. So what is a reauthorization? So this Child Care Development Block Grant was reauthorized. It is an update to the rules and standards governing child care in the state. So again, the law was passed in 1996, and it was updated because a lot of things have changed in 20 years. A lot of research has come out on child development. A lot of safety rules need to be updated. And that was the first time the program was authorized in 1996. So obviously they've seen how the programs are running in states. I want to take what some states have done and make it law for every state, and they want to update some of the standards to maybe take out parts that aren't working as well. All right, so the reauthorization was was geared to make changes in the following areas. So they wanted to update consumer education and health and safety standards. They wanted to change program standards and quality improvement activities, or update them. They wanted to update and make more family-friendly policies, and they wanted to make some rules around payment rates and practices. And many of these changes in the federal law are already in place in Illinois, and we'll go through that. However, there are some changes that the state's going to have to make, and some of it is going to cost some money and add some work for providers. So like I said, and all the changes will have to be made within a 3-year period. The changes are maybe as soon as a year. There's one in 2 years, which I'll note later, and then it's about 3 years. The state originally had to have a state plan on child care every 2 years. That has been extended to 3 years. So when states update their state plan, they have to have a plan to make the changes in the 3 years of their state plan. So let's go through some of the changes. So in the consumer education and health safety standard updates, there are some big changes here for providers. To use CCDBG funding, states are required to have annual inspections of license-exempt providers. And that's something that the state has not done in the past. That's something most states, or no state does, because the idea of being license-exempt is that you don't have to go through an annual inspection. So that is a requirement going forward. There's also mandatory health and safety training to be completed pre-service. So now, obviously, their current licensed providers have to go through these trainings, but there are more mandatory ones. So the mandatory ones would include control of infectious diseases, natural disaster preparedness, trainings like that. So while we may provide those trainings, they're now mandatory for you to take. And these trainings, these pre-service trainings, will also include license-exempt providers. One of the safety standards that are actually being implemented throughout the states are background checks for non-relative providers. Illinois already requires background checks for non-relative providers, so that is not a change to Illinois standards, but it is changed to every state who does not currently do that. So that's an example of one of the big changes that Illinois is already a leader on in the states. Program standards and quality improvement. Illinois already meets the majority of these changes in the law. Creating a tiered quality improvement system. Illinois has had one for a long time. We just updated. It is now called Accelerate. There are updated training requirements for providers, which we already meet. Creating developmentally appropriate class ratios. In our state, we already have a pretty defined set of ratios. Some states do not have ratios for teacher to child ratios. So again, we are a leader in that. And setting aside funds for quality programming. Illinois already spends well over the required percentage for quality. It's currently 3%. And at the end of implementation of this program, it'll have to be up to 9%, but Illinois already spends over 9% on quality funds for providers and children. So the next category that was updated were the family-friendly policies. This is the area where states, the feds are asking states to really ensure that they're serving the highest need children in highest need areas. They want to make sure that that the federal money is going to children and families that need it the most. So the big change here in family-friendly policies for states is it's going to require 12-month eligibility for families in child care, regardless of the change in work and education status of the parents. Sorry, that should be temporary changes in status. So this is a big move. A lot of us have been advocating for this in Illinois for a long time. We know it's going to cost money, but we also know that it's best for children to be in continuous care, and it's best for parents to have continuous care so that they can go about their day. Schedules change, educational and work activities change for a lot of families, and they shouldn't have to worry about where their child's going to be during a disruption in any of those activities. So again, while this is going to cost some money, and we'll talk about that in a couple slides, this is extremely important and great to hear from the feds that we're going to be required to make this change. And then finally, payment rates and practices. Illinois is pretty advanced in how we determine our rates. We could definitely argue that the rates are not high enough, but there is some method, rhyme and reason to how we do it. So all states are going to be required to have a market rate survey. Illinois does this every 2 years, I believe. States can have sliding scale co-payments, so co-payments don't have to be the same based on income. So in Illinois, we do have a sliding scale. If you earn at federal poverty or below, the state can actually implement no co-payment. I think we have a $1 or $2 co-payment right now. And the co-payments go up based on your income, and we work tirelessly to ensure that the co-payment is never 10% of a family's income. It's never more than 10% of the family's income. I believe we're below that, near 7% right now. So we're fighting to keep that where it is. Differentiated payments based on the age of children, geographic location of providers, et cetera. So in our state, you get a higher reimbursement rate for an infant than you do a 4-year-old or an after-school child. And we also have different rates based on where you live in the state. So the rate in Murfreesboro is different than the rate on the North Shore. Just to take the examples we have, the change of representatives. So the rates are different. We're allowed to do that, and now it's written in the law that you can do that. All right, so those are the big changes. Those are highlights of the big changes in CCDBG. So some of you may recall that we wrote comments on rules in early 2013 on CCDF rule changes. So CCDF rule changes were introduced because the agency, Health and Human Services, wanted to make changes to and update the child care practices in the states. Unfortunately, at that time, there was no will in Congress to actually make a legislative change. So rules were introduced, and the rules are similar to the rules that actually were passed in the CCDBG law. So needless to say, those rules of 2013, which were not implemented, are now no longer going to be implemented, and they're going to be replaced by the CCDBG law, which includes many of the rules in CCDF and a couple more changes. So the feds, so the way we're going to go about this in the state is that the Illinois Department of Human Services Child Care Advisory Council is tasked with advising the department on the implementation and suggestions for how to move forward with the new CCDBG law. And just in case you're wondering, the Child Care Advisory Council includes advocates, providers, the department itself, the Department of Family and Children and Family Services, to work through the best policies for child care. So this is a group of, the Illinois Action for Children is a part of, and they advocate generally for the best for families. So it's good to see that this is in good hands moving forward. So implementation will begin starting in spring and summer. The feds will actually be issuing guidance memos instead of a rule change on different sections of the law. So those guidance memos will come to the states, and they'll explain to the states how they want them to, the parameters around implementing CCDBG, and we will move forward from there in the details of how we implement the changes in the law. So, I know many of you are looking through this and you're like, wow, how are we going to pay for monitoring all of license-exempt care? How are we going to pay for 12-year eligibility? There is no guarantee of new federal money. While the CCDBG law does have slight increases written into it every year, again, as I explained before, those are discretionary. So those are up to the amount of money that the committee at the time is willing to place into the program. So there's no guarantee of new money to cover the costs. And of course, and again, Ceci will talk about later, there's no guarantee that we have enough money in the state to cover the cost of the changes. So this is a big push for us going forward. And I'll talk about that briefly in the next steps. So continuing with the federal update, there's only one more item to discuss, is the White House Summit on Early Childhood, which is actually happening tomorrow. President Obama will be hosting a White House Summit on Early Childhood. The summit will bring together a broad coalition of philanthropic, business, education, advocacy, and elected officials who are committed to expanding access to high-quality early childhood education. But what's also at this summit, a bunch of federal or a couple federal grants will be announced, which Illinois has applied for. There's $250 million in preschool development or preschool expansion grants. It's the first round of those grants that will be announced. Illinois has applied for preschool expansion grants, and these grants will cover full-day care for full-day preschool for 4-year-olds. And then there's $500 million to be dispersed in early Head Start child care partnerships. Again, Illinois has applied for that money as well. So we're hoping tomorrow to have some really good news on these grants. The Head Start child care partnerships are designed to improve access to high-quality infant toddler care in high-need communities. So again, we hope to have some good news tomorrow on that effort. You know, of course, getting money from the feds for early childhood is never a bad thing. So next steps, what are we going to do next? So the first thing we're going to ask you to do is to please meet your federal legislators. Again, you have 2 new ones, but you have 16 others that you may not have met before. Have them visit your program. Please teach them about the importance of child care and early education. Remember, you all are the experts. They are not, for sure, but many of them have young children or young grandchildren. And they actually think about these issues on their family side, maybe not on their work side. So making sure that they can connect what's happening in their lives to how they vote in Washington, D.C. is always a good thing. And Illinois Action for Children is here to help. Please feel free to contact me. You all have my email address, but we will send out our contact information. I'm willing to help you set up a visit, to help you think through an agenda. I'm also willing to be there. I will drive pretty much anywhere. So please feel free to contact me on that. And then our call to action here is for federal budget advocacy. While there may not be any more room to advocate for the FY15 federal budget, which is actually happening right now. You know, the FY16 budget will start next September, and you know, after the guidance memos come out this spring and summer, states will begin to implement the changes in CCDBG. And like I mentioned before, we know it's going to cost money. So we really need to be part of the federal budget process this year, even more so than ever. So let's be ready. The president usually releases, he has a State of the Union address in January and then releases his budget within a month after that. So we will send more information on the federal budget, but we will also be looking for you to help spread the word to your legislators, because you live in their districts and they understand you well. So please feel free to give me a call so that we can set up meetings with legislators and we can advocate on the federal budget to make sure that there's enough money for child care in Illinois. All right, well, thank you. I'll now pass the torch on to Ceci. She is going to talk about, she's going to give us a state update, talk about the midterm elections and the state of our current year and future budgets going forward. Thank you.
Okay, good afternoon. So I get the fun task of talking about what's going on here in Illinois, close to home. And so just an overview of kind of what I'm going to try and cover is to talk about the fact that we have a new governor. It's been a while since we've had an election that brought us a new governor, as most of you know. So we'll talk a little bit about that, even though there's not that much to say yet, because we don't know not much more than you. But all the other things that happened with the new election in terms of agency staff in the House and Senate in our Illinois General Assembly, the ballot questions that were on everybody's ballots, we wanted to just mention because they do kind of overlap into our General Assembly conversations, but definitely kind of affect all of us in one way, shape, or form, as well as kind of influence the conversations that we can have. We'll talk a little bit about veto. Again, not much to say there. So just in terms of the new governor, Governor-elect Rauner will take office in January 12th. He will be sworn in along with new members of the General Assembly, as well as everybody who is in the General Assembly and was reelected. They will also be sworn in for their new terms. As you know, the House of Representatives, much like in Congress, are up for election every 2 years. So it does feel like to them and to us that they're pretty much always ready for the next election, or dreading the next election as it is. In the Senate, there are staggering 6-year terms, as is in the Congress. Is that right? Staggered 6 or 4?
In the House, 2.
In the Senate, there are staggered terms.
And it's 4-4-2. 4-4-2.
Oh, it's right. 4-4-2. So in the Senate, in the Illinois Senate, some people get 2-year terms, and then they'll get a 4-4. Some people will get 4-year terms, and then they'll get another 4, and then they'll be up for re-election in the 2. The idea is that so we don't ever lose the entire Senate at the same time. The other thing that happens, so what I can say about what we know from the campaign with Governor Rauner is that he is a big supporter of education and education reform. He's definitely made it a big part of his campaign. Unfortunately, other than saying that he wanted to kind of increase funding and expand education for Illinoisans, we assume that that meant early childhood. We know that he has much knowledge about early childhood. But what we also know about him is that he is, and today I think he announced specifically that he would not extend the current tax rate of 5%. We know that he has concerns about Illinois spending and believes that taxes are too high. And so he is unclear, he has been unclear thus far in terms of how he would pay for an increase in education funding or an expansion. So those are things left to be seen that he himself and his new administration will have to work out and tackle pretty much on the first day of his new term. The other thing that happens with an election is that, especially with the changing governor, I should say, is that the state agency directors, those people who lead Healthcare and Family Services, the Department of Children and Family Services, the Department of Human Services, they all serve at the will of the governor. And so they are oftentimes replaced when a governor changes. They bring in new leadership in those state agencies because those state agencies are really arms of the state and of the governor's agenda. And so we know that those state agencies, well, we assume that almost all, if not all, of state agency directors will be leaving in January, and they will be replaced by yet-to-be-named new directors or secretaries. And so, and there are, some people that will go with them. So that's, again, left to be seen in terms of what new faces there will be, but we know that there will definitely be new faces to learn at each of the state agencies that we work with. The State Board of Education is a little bit different. They have a little bit more autonomy. The new governor does get to appoint at least, or no more than 5 of the State Board of Education board, and to appoint the superintendent. In some states that is an elected position, but in Illinois it is not. The House and Senate, we didn't see that much change. The important thing to know is that a supermajority exists in both chambers, which means that they can override a governor's veto because they have a majority of seats. Both in the House and the Senate, they are controlled by the Democratic Party. As you know, House Speaker Michael Madigan will remain Speaker of the House, and Senator Cullerton will remain the President of the Senate. And so and already Senator Gordonio, who is the minority leader in the Senate, has retained her seat, and Jim Durkin will also remain as minority leader in the House. So we don't see any change of leadership in terms of the heads of each of those caucuses in the House and Senate. On the ballot, we had a very, very long ballot. It was one of the reasons why voting this year took a long time. There was lots of other reasons. But there were, I think, 5 ballot questions. They are advisory in the state of Illinois. Some states, ballot initiatives or ballot questions are binding. They are not. They are simply advisory in the state of Illinois. So the 2 that we most closely followed were the minimum wage. There was a question regarding raising the minimum wage in Illinois. We are part of a larger coalition that supports an increase in the minimum wage. And then there was also a proposal last year in the House by Speaker Madigan around what was called the millionaire surcharge. So it was an additional tax on persons that earn more than $1 million. That went nowhere in the General Assembly, but he did. It was put on the ballot as a question, and so that did in fact pass with and both of those things passed with an overwhelming majority. Again, they are non-binding. They are simply advisory, and it is a little kind of quick and dirty way to take a poll, so to speak. Finally, the veto session, yeah, not much happened. There's 2 weeks of veto session every year. For those of you who don't know, Illinois General Assembly runs in 2-year cycles. So we will begin a new cycle in January, meaning that it's a fresh start. All bills will be, any bills that were alive during the veto session are now, they're no longer movable in the new General Assembly. We'll start afresh in January. In veto session, there was initial hope before the election that we might do something around the revenue question. We know that we have a revenue shortfall for this year's existing budget. That did not happen. We also were working with our coalition, our Safe Sleep Coalition partners, with Kids in Danger in the lead on a bill that would ban the sale of crib bumpers. That's already banned in the city of Chicago, and it's also banned in all child care programs in the state of Illinois, but we were looking to ban it outright, and we were not successful to be able to call that bill for a vote, so we will start again in January. So that's pretty much what we did in veto session. It was short. Both weeks were kind of cut short, and at the end of the day, not really much was accomplished. So moving on to the big enchilada. It is the state budget and the revenue situation in Illinois. You all know, if you read anything that you get from us and come to any of our meetings, you know that revenue has been an ever-present concern and priority for us in terms of making sure that the state has adequate resources to fund services for children and families, child care and early education being a huge part of that focus. You will probably also know and remember that in 2011, Illinois passed an increase, what ended up being a temporary increase in our income tax rate to take the personal income tax rate to 5%, as well as the business tax rate. But that bill would what we call sunset or expire January 1st of 2015. That date is upon us almost. And so our tax rate will go down to 3.75. We had hopes as part of our, along with a larger coalition of the Responsible Budget Coalition, to really work to maintain the same amount of revenue. We were flexible in terms of how we maintain that current level of revenue, whether it be to extend the 5% for a couple more years, or other tax strategies that would garner the same amount of money. That was not successful in the full legislative session last year. It was not raised during the veto session. The House has committed that they will not come back for a lame duck session in the early days of January. So it is all but assured that that 5% will in fact expire and go back down to 3.75 in January. The impact that will have is significant, both short-term and long-term. For FY15, which is the current, we're about halfway through our current federal fiscal or our state fiscal year. To remind you, our state fiscal year runs July 1st through June 30th. And so you always have to figure out, you know, if money is going away, it's not going away for the full year, it's going away for half of the year. It'll go away for the full calendar year of 15, but only half of our current state fiscal year. So the FY15 budget is about $2 billion out of balance because we predicated the spending on the full year of having that 5% revenue source. Because it will be going away for the second half of the fiscal year, we're going to fall out of alignment or out of balance, and that figure is about $2 billion of our general revenue fund that we'll lose because of that lowering tax rate. Again, we had hoped that legislators would take action in January, but it didn't. But it looks unlikely that that will happen. And many agencies, and some of you might have been on a call yesterday with Michelle Sadler that was organized by the Illinois Partners for Human Services, and many of you could have been having conversations on your own as we have been doing. Many agencies will start to run out of money much sooner than later, and so we have an impending crisis on our hands. It is unclear without the current revenue source that we have how the state will approach this. And so that is, again, for the new administration to tackle in January. But unfortunately, he will walk into the state governor's office, and pretty much many programs will be, in fact, running out of general revenue fund right around the end of January. They still have federal dollars to pull down to pay for services, but it's a question of will those be enough, and will those payments from the feds flow in a timely manner, given that it's the only source of revenue that we have left to rely on, as opposed to usually we would have a mix of state and federal, so we stagger how we spend our state money so that we can always make sure that we have it kind of a cash flow, so to speak. But we have somewhat gone through our state cash, and so now we're going to be almost entirely dependent on the federal dollars that come, and they don't come necessarily as frequently as we need to make payments to providers and to pay for services. So that's where we are on state budget and revenue. It's not pretty. It's not looking good. But let's go to the next slide and continue the nightmare. So the impact on child care. We have, I'll cut to the last bullet point first. We have right now, as far as we are able to estimate in conversations with OMB and the Department of Human Services, OMB, I'm sorry, is the Governor's Office of Management and Budget. And the Department of Human Services has their own budget office, who we work with very closely. It is estimated that child care is right now about $300 million short of a full year's budget. Child care is funded at almost $1 billion, so over $900 million. And we're about $300 million short. So we're pretty much running almost a full quarter year short of revenue to pay for services. Again, much of the general revenue, the state's money will run out in January or early February. We will rely on our federal pull-down dollars from the CCDBG that Samir talked about to finish out what we can of the year. But as Michelle Sadler said on the call yesterday, we are so far into this fiscal year that they can't absorb this kind of shortfall. This can only be addressed by some pretty draconian cuts. And just, so they are generating some scenarios. I suspect that they will leave those for the incoming leadership of the Department of Human Services and the governor, but it is not their decision to make. They are on their way out. But it will not be easy for anybody who has to make the decisions that I assume will have to be made if no new revenue is generated in a very timely manner in the new calendar year. So just to recap, we ended the full legislative session at the end of May, knowing that child care was not fully funded. Many, many programs across the state were not fully funded at the end of May. The hope in May of last year was that they would extend the 5% tax, and so all budgets that were introduced were predicated on having the same amount of baseline revenue as we had in 14. In the last weeks of session, it became clear that they were not going to pass a revenue extension of 5%. And so at the last minute, some cuts were made, but the assumption was that we can't do revenue now, but we will come back in the fall and do it. And so they said, we'll cut budgets because we have to constitutionally pass a balanced budget. And they did that through some short-term strategies. In terms of one-time cash fixes in certain places. But what we know now is that there is no additional revenue coming in the short term, and that 5% tax rate will indeed expire on January 1st. And so we are really left with an incredible shortfall. So at the end of last session, we had an $84 million reduction in the actual appropriation from what we started out in terms of the governor's office and DHS proposing to what we ended up with the General Assembly passing as a final budget. So that was already $84 million reduced. In addition, there were some things that we knew had not been figured into what the full need of child care would be in 15. Those included increased caseload growth, right? Every year we see a little bit in terms of more families accessing the system. We also know that we have an increase in cost per child because more families are using and choosing center-based care as opposed to family, friend, and neighbor or home care. And that is particularly true for infants and toddlers. They are the most expensive form of care in terms of if you have centers, infants and toddlers in a center, that is the most expensive care for the state to pay for, so, and for families to pay for. And so we see an increase of caseload number of kids. We see an increase in the cost per child in terms of caring for the children in the Child Care Assistance Program. We also had some obligations. The governor had committed to reduce co-payments to try and regain ground for families when we had to raise co-pay significantly in the height of the economic recession. And we also have commitments to family child care providers through the SEIU collective bargaining agreement to increase the rates for family child care providers, both licensed and license exempt. And so we knew that we had these pressures on the child care budget. They were not kind of figured in, if you will, into the budget ask. And so we're not just short that $84 million at the beginning of this fiscal year. We were, in fact, short closer to about $190 million. On top of that, you know, things just love to get worse. The state of Illinois implemented an electronic case management system in January of this year, of 15. That has not gone well, as many of you know. As a result, there have been some administrative fixes that we've done along the way to try and ease the pain that families and providers feel as a result of this kind of computer glitch or systems glitch. And as a result, that has increased the cost of the Child Care Assistance Program by about $100 billion. So because of that, basically we have a 12-month period when it's all said and done, pretty much this entire calendar year of 2014, we have provided presumptive eligibility for families in the Child Care Assistance Program who are trying to stay in the program. Not for new families coming in, but for anybody that was in the program in January of 2014, they've pretty much been allowed to stay in the program because we can't accurately assess whether they're really eligible because of these computer problems and systems problems that's occurred. And so we've just let them stay in. As a result, we have a much higher caseload than we had anticipated, and this is causing a pretty significant budget impact on the Child Care Assistance Program. So to end where I began on this slide, the Department of Human Services has asked for a $300 million supplemental to simply shore up the current fiscal year in which we were in, right? So this fiscal year started July 1st. It will end June 30th. We are going to be short. We are short at this point in time $300 million in order to get us to the end of the fiscal year. So going forward, this has clearly huge ramifications for the year that we're in, this fiscal year. It also has significant ramifications for the next fiscal year 16 and beyond. So again, going back to the revenue source, the 5% tax rate, for this fiscal year, that's going away for half of the year. We have to kind of double the impact. So if this year that means it's creating a $2 billion hole, next year it's going to create actually a little bit more than that $2 billion. So it's estimated that it will create a $5.4 billion budget hole in FY16. There has to be a short and a long-term strategy here by the state. State agencies already have been asked to work up some budgets that represent a 20% reduction in their overall spending. So that doesn't mean across-the-board cuts. So if we look at the Department of Human Services and across-the-board cuts, they have many programs that are quite small in amount in terms of their budget lines. And so you will disproportionately take more from bigger lines because if you took 20% away from some lines, it leaves almost nothing behind, and it doesn't actually generate very much money for the state in terms of savings. And so because child care is one of the largest state budget lines in the state, it is always disproportionately hit when cuts have to be made. So we're kind of getting it from multiple ends here in childcare in terms of having started out the year in a whole. We have no revenue on the horizon, and we are also going to kind of be part of that larger revenue reduction strategy in terms of that revenue going away. So the governor, so we know that cuts are going to have to be made across the board, not necessarily unilaterally across the board, but cuts will be made. There are other parts of the budget that are also in significant shortfall in terms of the revenue they need to finish the end of the year. Childcare is by far the worst, in the worst shape as it relates to kind of the human services side. Corrections is also in deep trouble. They ended the year also with not enough revenue to get through, and that also creates an immediate crisis as well. So that's where we are with probably what you need to know for the budget. And I suspect maybe some questions will be coming in about that. We always want to think about what we can do. I tell my daughter, let's not worry about the things we don't control. Let's try and focus on the things that we can control. And what we can control is the fact that we do have a new governor, that we do have new legislators in the General Assembly, and we have our old legislators who are still there that need to be reminded of the role that childcare plays in their communities, and how the system of early learning is really critical to our state's economic success, the success of families, for really building an education system that makes people want to live and work in Illinois. It's all connected. So meeting your legislators has always been a kind of central part of our advocacy strategies. And so for those of you who live in districts where you have new legislators, we have 2 new senators and 17 new representatives. So they're a clean slate, you have to assume. And so we always encourage to get out early and often, so to speak, inviting them to your program, visiting them in their district, always making sure that if you visit them in their district, make sure that you try and see them in Springfield so they make the connection that you see them and you pay attention at home and you also follow them and watch what they're doing in Springfield. It is that accountability, I think, that we build into our advocacy that really makes us so effective. And really always talking about what you know about FEST, which is not the policy process, which is not the bills, which is not the budget. It is the role that child care and early learning plays in their community and helping them understand who in their community relies on early learning and the impact it will have on his or her district, if it were to go away or be minimized. So again, this is something that we're always here to help on. We want to partner with you. We want you to see us as your kind of policy experts, as your go-to people when you have questions about what to do and when to do it or how to do it, and we're always here to support that work. We are only as good as our statewide membership and our advocates and members. So really, there's a crisis. We're in it. It's now. It's this year. The money's running out. And it's unclear what the state's strategy will be about that, but we know that they're having conversations about doing something because they don't have a choice. But we also need kind of continued advocacy as it relates to out-year budgets, and that really is closely related to our call for revenue, adequate revenue. We are not prescriptive in terms of what that revenue source is, or what it looks like, or how you cobble something together. There are lots of scenarios in terms of how you can make out the same amount of revenue that was generated through a 5% income tax. We are not tied to an income tax. We are not tax experts. We know that the Illinois revenue situation is dire. We have an antiquated kind of system of how we generate revenue. We tax kind of the wrong parts of our economic system, and it leaves us short of really providing the services that Illinoisans need and deserve. And so we have always been an advocate for additional revenue, but never prescriptive in terms of what the source is. So we're always looking to partner with you. We will clearly be updating our resources and our community profiles and the information that you can use in your districts to educate legislators. And so we'll be doing that, but also, we're always here to answer your questions and to help you out. So please always know that we are here. And then we also have some upcoming dates that we want to put a save the date on your calendar. Some of you may remember, we went through a process last year of really assessing our public policy caucus, and that assessment and analysis and internal conversations here, along with some targeted conversations with folks around the state, that has led us to move towards a regional caucus structure. And so instead of always having them in Bloomington and Springfield, we will be kind of rotating and moving around the state to bring those caucuses closer to your home, and also really closer, really building on the fact that we are a large state with very diverse regions, and so we want to take the caucus out to those different regions. So we have two scheduled. They will basically be the same meetings in simply different places. So don't feel compelled to put both of these on your calendar. Put whichever one is closer. And there'll be more later on in the year that would focus on different geographic areas of the state. And then in June, we will always have the one statewide caucus that our members told us they always wanted to have, just to get the update in terms of what happened in Springfield for the year. So the two dates that we have right now, Thursday, January 22nd, will be in Naperville, Illinois. These are meetings that will go from 10 a.m. to 3 p.m. And then the Thursday, January 29th, will be in Bloomington, Illinois. And again, they will be basically the same meeting. They will focus on really what we know at that time, looking ahead to the session in front of us, as well as what we know from the federal developments from both the CCDBG reauthorization and the guiding memos that we're expecting from HHS, but also then the news and implications of whatever is announced tomorrow in terms of the pre-K expansion grant and the Child Care Head Start, early Head Start partnerships. So those are some save the dates that hopefully will make it onto your calendar. And then, of course, our Spring into Action conference, always getting a little bit better every year. Will be, I think, either we did this week or we'll be coming out soon with kind of an announcement of who are some of our keynote speakers. We will have a theme partnering with our friends at the University of Illinois, the Family Resiliency Center, and so really focusing on some health components in terms of, and specifically the role of child care as it relates to public health and the health of young children. And so that's exciting, and we'll be in Springfield on April 21st and 22nd for our Spring into Action conference. And the legislative calendars just came out last week, and we know that the legislature will in fact be in session while we're at the conference, which is always a good thing because we always want to make sure that we go over and see them. So definitely, I hope that you'll join us for that. So that's kind of an update on where we are with the state. It's not been a very heavy bill year, as you know, and probably won't be in the coming year. It really will be focused on fighting cuts and generating some revenue, some interest and will in the General Assembly to create some new revenue streams for the state of Illinois so that we can adequately fund programs for children and families. So that's the end of the state portion. And now I think we're going to go to your questions.
All right. Well, hello everybody again. This is Samir. So I will leave the save the date up if you want to mark them down while we go through some questions. So our first, well, we had a couple questions on how will this be made available, this presentation. The webinar is being recorded, and we will have the webinar and the slides up on our website hopefully by the end of the week. That is the goal. We will also be having a Spanish webinar next Tuesday, and if we will send information out about that as well. There was a question about by license exempt providers, do you mean centers or homes? So the way the law is written about monitoring for license exempt providers and pre-service hours, it's for all providers. So really there's no distinction between license exempt and license when having to comply with that part of the law. So license exempt homes and license exempt centers will all be subject to, and their staff will be subject to monitoring as well as pre-service hours. We had a question, this is a great question actually, about are we going to introduce the fair tax again? So if you all recall, the fair tax was a bill that would allow the states, it's actually a change of the Constitution, that would allow the states to move to a graduated tax or a multi-level tax based on income tax based on the size of your income. So right now we have what is called a flat, excuse me, what is called a flat tax. So everybody, regardless of income, is charged 5% of their income in the state income tax. So it'll be 3.75 starting in your first paycheck in January. What the federal government does and other states, some other surrounding states do, is they actually increase your rate based on your income. This actually brings in more revenue and captures more growth, because growth in income tends to be in the highest bracket or in the highest earners. So we would actually capture more growth, more revenue growth, more of that revenue growth by having a graduated income tax. So while yes, I would love to introduce this fair tax, again, it has to be introduced and passed in a year that there's an election, which is why we were working on it in 2014, was because there was an election in November of 14. So this bill can be reintroduced again this year, but it wouldn't go. It would just be passed. The bill would be passed to then go on the ballot in the 2016 general election, presidential election. So while it could be introduced, the changes couldn't happen until 2017. So we need to work on revenue solutions now, as Ceci was saying, not necessarily only tied to the income tax, but any kind of revenue that would help the state not go further into a hole. Let's see, there was a question, and actually, Ceci, I wonder if you could answer this one. There's a question about what is the Governor's Office of Early Childhood Development staff, what is their situation with the new governor? I know some of them have contracts, but it is in the governor's office, so I don't know if you can explain what you feel will happen with the staff there.
Yeah, that's a great question, and I apologize for leaving that out. So the Governor's Office of Early Childhood Education, or Early Childhood Development, the director of that office, Teresa Hawley, will either be asked to stay or to go by the governor's office, I suspect. It's a bit new because it's not a codified state agency, so there's not an official kind of serves at the will of the governor. But clearly it is kind of an offshoot of the governor's office, and so they need to be there by will, and that they want to be wanted, right? So so I think that is a negotiation between the current director of that office and the governor-elect. So, and I don't know, I'm not privy to those conversations, and so that is a role. The majority of people who work in the Governor's Office of Early Childhood Development, as Samir mentioned, are contractual employees. They're actually not employees of the state. They have a contract with the state for employment. So they have a contract. At the end of that contract, they would always be subject for review and extension or termination. I suspect that will be true regardless. That would have been true if we had not changed people in the governor's office. So those are, I don't know what the terms of those contracts are, but those are contractual employees, and so I suspect that they will just have to be renewed as contracts or not. And that I suspect that maybe some of those decisions will also be based on whether we are a chosen state in terms of either of these grants that will be announced tomorrow. Much of that work and the kind of concept and frame of the work that was proposed in those grant applications was really the product of the current staff and office. And so if we are in fact granted monies to do that work, hopefully there will be seen as kind of value in maintaining some of that brain power to see it through. But again, it's unclear, and it's a little bit different because it's not a codified state agency. So it's not as clear lines as, say, the Department of Human Services.
All right, thanks, Ceci. And then the last kind of question is kind of more of a comment, was about a lot of the quality initiatives and changes may actually be too burdensome for a lot of small providers and may cause them to close. I just wanted to address that by saying, look, this is why we're advocating for revenue around the quality initiatives and the quality changes. You know, legislators want to know that when they're spending, say, money on childcare, that at least some of it is going to high quality, or what they believe are the highest quality providers. And we need to work as advocates to support the rates, or to support the incentives that make sure that quality can be attained, and in a cost-effective way. So I think, you know, instead of, looking at it from the negative side is, oh, well, providers may close down. We should look at it as an opportunity for us as advocates to really fight for the funding needed to make sure that quality programs aren't forced to close because of the cost of providing that quality. So I think that's a good way to end it. We have to get out there and we have to advocate for adequate revenue. Unfortunately, we end up talking about taxes more than early childhood, but I think that we, as Ceci mentioned, we need to really connect what's happening in early childhood to the communities of the legislators and let them know that by supporting adequate revenue that we're supporting the children and families in their districts. So with that, I'm going to call this meeting to an end. We went over about 5 minutes, but thank you for saying I actually didn't see any drop-off, so that's great. Thank you for sticking around. And again, if you have any questions, please feel free to email me or give me a call. You guys should all have my info, but we will send it out with the recording and the slides from this presentation.
And definitely stay tuned tomorrow for the announcement from the White House in terms of successful grant applications from states in terms of pre-K expansion and the Child Care Early Head Start partnerships. It hopefully will be exciting news and really will set the stage for going forward. So and we will really, I think, particularly given the times that we are in as it relates to the funding crisis for early childhood education, we will most likely be doing more of these webinars. So if you have some feedback for us in terms of if these are helpful, if it was too much information in the given time, please do let us know either through emailing us or however most of you know who we are and how to get a hold of us. So we do, we're always looking to learn and do better, and so we appreciate your participation, we appreciate your input, we appreciate your advocacy and your leadership on behalf of children and families. And we hope all of you have a safe and lovely holiday, whatever you might celebrate. Thanks.